What if I told you your arteries aren't pipes you can scrub clean with a bottle of drain cleaner? That's right. No magic potion, no miracle juice, and definitely no artery detox supplement is going to melt away years of damage. But here's the good news. You can reduce the danger. You can shrink those plaques. And most importantly, you can protect yourself from heart attacks and strokes. Let's talk about how. A lot of people imagine their blood vessels like plumbing. You pour in too much fat and cholesterol, and the gunk builds up inside. No problem, right? Just flush it out later. Well, our bodies don't work like that. Inside your arteries, it's more like a construction zone than a clogged pipe. These things called atherosclerotic plaques slowly build up over time. Think of them like little blisters or volcanoes forming on the inner walls of your arteries. They're made of fat, dead cells, and a lot of cholesterol, all wrapped in a tough outer shell. And the longer they sit there, the harder and more dangerous they get, especially when calcium joins the party and turns them rock solid. So why do these plaques even form? Blood is supposed to flow smoothly through your vessels, but in certain spots, like where arteries branch off, the flow gets a bit chaotic, like little whirlpools. That turbulence can damage the lining of the arteries. Now imagine that lining like soft skin. When it gets hurt, it's easier for bad stuff to stick. If you also have high blood pressure, high blood sugar, or a lot of inflammation in your body, those little injuries get worse. Add too much LDL, that's the bad cholesterol, and it starts piling up inside the walls. At first, these plaques don't cause much trouble. You probably won't even notice them. But as they grow, they start blocking blood flow. Once they block 60% or more of an artery, you feel it. In the brain, that might mean dizziness or confusion. In your legs, it might feel like pain when walking or cold feet. In serious cases, your toes might not get blood at all. And that's when things can get scary, like tissue damage or even gangrene. But here's the real danger. Sometimes these plaques don't just sit there. They explode. The surface cracks open, and all that fatty, inflamed goo inside spills out. Your body sees this as an emergency and forms a clot. If that clot travels to your heart, it's a heart attack. If it lands in your brain, it's a stroke. And here's the kicker. Many people have no idea it's coming. Your artery might be almost completely blocked, and you won't feel a thing, because the body's amazing at building little backup paths, like detours called collateral circulation. So even if one road is closed, another opens. That's why some people can have a 90% blockage and feel totally fine, until something ruptures. Now let's talk solutions. Can you get rid of plaques completely? Number, not entirely. But can you shrink them a bit? Yes. Studies show it's possible to reduce their size by up to 24%. That might not sound like much, but even a small reduction makes the plaques more stable and less likely to rupture. The first clue that plaques could shrink came after World War II. Researchers compared people who had gone through long periods of hunger with those who hadn't. And the hungry folks? Way fewer plaques. Why? Because their bodies weren't overloaded with fat and cholesterol. More recently, a doctor named Dean Ornish ran an experiment. He asked people to follow a strict plant-based diet. Very low fat, no meat, mostly fruits, veggies, legumes, and a few low-fat dairy options. He also had them exercise daily and manage stress. And guess what? Their plaques got smaller. Their arteries actually got better at letting blood through. Now, this kind of strict routine isn't for everyone. It's tough. You need serious discipline. For years. But it shows something powerful. Our bodies can heal if we give them the right tools. Another big tool? Statins. These are medications that lower cholesterol. But they don't just do that. They also stabilize plaques, meaning they make them harder, safer, and less likely to burst. Think of them like armor for your arteries. Studies show that statins can shrink plaques about as much as lifestyle changes, around 24%, and help reduce the risk of sudden, dangerous events. So what's the best approach? Not just one thing. The most effective strategy is a mix of three: a smart diet, regular exercise, and medication when needed. You don't need to go full monk mode. You just need something realistic, something you can stick with. Can you try just lifestyle changes alone? Sure. But most people can't keep up that intense level of discipline for years on end. A balanced diet, daily movement, and support from medication can go a long way, and that's way more sustainable for most people. Now, maybe you don't like the idea of taking statins. That's your choice. Just make sure you understand the trade-offs, the risk of not treating those plaques versus the side effects of the meds. Talk to your doctor. Make an informed decision. At the end of the day, here's what matters. Plaques don't have to define your future. You have the power to stabilize them, shrink them, and stop them from ruining your health. It takes time. It takes effort. But it's worth it. Your heart works hard for you every second of every day. It's time to return the favor. Stay consistent, stay curious, and take care of that incredible machine inside your chest.